Hey everybody, welcome back to nature. We're starting our week number 6 actually right now, and we're going to be talking about sleep, emotions, and hormones, something that I think most of us can relate to. All of us have probably had either we're doing great in that area, or more than likely we might have had something kind of go wrong in one of those areas at some point. Maybe you're still dealing with that. A lot of times we don't appreciate those particular areas of health until something goes wrong. I know that was me. And so that's kind of what we're going to talk about tonight. And the first thing I want to mention is that common does not equal normal. Okay, so let that sit in, jot it down. You may have to think on that one for a little while. But here's the thing, it's not normal to feel so unbalanced, okay? That you have to be uncomfortable all the time, okay? So what you hear of other people saying, well, I just always feel out of sorts. I'm tired all the time. Oh, my period started, man, it's always a doozy. It's awful, and that's just what's normal. I want you to think about that. It's common, okay? Maybe once you hit a certain age, you just think that good sleep is completely out of the question. That's not it, okay? That is common. It's not normal, okay? So we're challenging that with the different information we're going to share with you tonight, okay? We're going to, think of cycles going haywire, thin hair, hot flashes or night sweats, okay? And guys, just a note, that's actually a lot of times a sign of heart, something cardiovascular going on, okay? So just note that. Maybe your intimacy with your spouse has changed, okay? Again, these particular things are not normal, okay? And so we chose these 3 topics because, well, for several reasons, but they're all kind of they interlink to each other, okay? And you're going to see that with everything we're talking about. So the first thing we're going to start talking about tonight is sleep. Let's talk about sleep. Okay, so sleep is free, technically. Getting yourself to bed on time. There's several things that you can do to affect and change your sleep for good, okay? So when you're asleep, your brain is actually detoxing. Your body detoxes, okay? Yep, it happens. It's better to go to bed early and wake up early, okay? I'm notorious for going to bed late and waking up late. Ideal time that you want to be asleep, you want to make sure your body is asleep between the hours of 10 p.m. to 2 a.m. That is the best time for your body to regenerate, okay? Your body likes to be asleep in those hours, okay? It makes everything else start to work better if you're asleep in those hours. Deep sleep does not actually equal quality sleep. And so I'm going to let Autumn talk about this. We were chatting about this earlier, and I think she's got something to share on this.
Yeah, so I mentioned this in a Back to Nature a few weeks ago, and I started going to a new dentist in Dallas. Not quite a year ago, but like 8 months ago, maybe. And one of the first things she asked me, she's pretty holistically minded. She said, "How do you sleep? Like, how well do you sleep?" I'm like, "Well, I sleep great. I sleep really hard. I rarely wake up. I thought I felt rested. That's a whole nother story. But I was used to being able to go to sleep when I wanted and sleep hard, and I thought I was good to go. Well, she did a sleep test with me, and I ended up, my oxygen when I was sleeping so well was dropping to in the 70s when I was sleeping, and I had severe brain fog. I still struggle with some of it, but it's a whole lot better than it was because I got fitted with a mouthpiece that I sleep with, and it just brings my jaw slightly forward on the bottom, and I can breathe so much better. And even I was telling Keely yesterday, if I even take like a nap 30 minutes to an hour without that mouthpiece, I wake up with a headache, and I wake up with a fog. It's really important to just because you're getting deep sleep, if you're getting deep sleep, that doesn't mean it's necessarily quality sleep. So it's something to think about. Definitely look into a mouthpiece if that's your thing. And then Keely's going to talk about a couple other options, tongue tie and lip tie, even as a lot of times babies will get those, but even as adults, sometimes we need revisions like that. So anyway, Keely, you can finish that up.
Yeah, that was something that I just learned about a little bit. And by no means, I am no expert in this area at all. I just know about it. And everything we tell you guys, please go research it, go look it up, be your own researcher. That's very important. So I have a friend named Landis, and she's a myofascial therapist. Okay. And she was talking to me about the impact of tongue ties and lip ties over your whole body, but specifically even tying in right here to sleep. The position of your jaw, and just like what Autumn's telling us, position of your jaw will change your sleep. It changes your air intake. But also, I mean, it's not, there's just so many different impacts. It even helped, I know reversing tongue tie and lip tie, she mentioned that it could help blood sugar balancing. It could also help with chronic posture issues. If your neck is more forward, if you tend to be more slooped forward, and including that with tension and like chronic back pain in this area. I was absolutely amazed by this. So go do some digging. If you think that could be a possibility for you, go do some digging, especially if you are having some challenges with your sleep. That could be a factor. Okay. And go check it out. Technology has advanced so much in recent years that this is something that you could have done. Okay. And it could impact lots of different aspects of your health. Let's go in to talk about sleep cycle. Okay, so there's 4 different stages of sleep. I'm not going to go through all of them. I'm not going to get into that. I'm not going to get into the brain waves and all that good stuff. But just know that to be able to sleep and cycle through all of those different stages makes an impact on your health. Okay, so let's say you have sleep apnea and you're actually waking up pretty frequently. You may not be entering one of those stages of sleep. You may not be getting into stage 3 or 4. That's actually pretty common. Remember, common and normal. That's common. Okay. And so, and what I did with the research, I found out that stage 3 is very important for restoration of the body. Okay. So for the repair aspect of the body. So that's something to even consider. There's all different kinds of sleep study places out there. If you're thinking that might be a factor, go check that out if you need to. You can also, okay, this was something we mentioned, when we're coming up with this class, we were thinking, use your sleep as a barometer to kind of measure what's going on in your life. Autumn, did you have any extra thoughts with that right there?
Well, it just goes back to what we were saying. Sleep affects everything. It affects every bodily process, and we know that in theory, but really it shows how well you're doing emotionally, which we're going to talk about. It shows how well you're doing hormonally, which we're also going to talk about. All 3 of these things are combined, and how you sleep can really tell you a lot about your health.
Absolutely. There's lots of different factors that can affect your sleep. And I'm not going to give you an exhaustive list, but just some of the things that we kind of came up with and thought of, environment. What kind of environment are you in? Or not even just that, but your environmental or bad habits. What are you doing? How close to nature are you living? And this goes back to our earlier weeks when we were doing our Back to Nature series, talking about week 1 through 3, especially. Okay. Like how much blue light are you getting? Are you getting outside and experiencing sunlight? That makes a factor. Okay. It makes a big factor on your sleep. So if you want to learn more about that, go back to weeks 1 through 3, and that'll kind of walk you through an environmental detox. What can I do to change in that aspect? Another aspect are the emotions, again, affecting your sleep. Maybe nightmares are a problem for you. Okay. Nightmares, night terrors, traumatic events in the past that come back to you. I get that. I get that that's a possibility. Yes.
So I had shared with Keely, I haven't told her this, so this is new information for her, but a few weeks ago, maybe a month or two. I can't remember. It's been a while. I was telling her I struggle with they're not nightmares in that it's like a terror thing, but I would have really like repetitive, not positive thoughts that would wake me up, and they were nightmares, but not in the traditional sense, if that makes sense. And she told me to try the Freedom oil from Young Living, and as far as I can recall, I have not had a problem since I've used that. So anyway, it definitely, your mental state affects how you sleep. Definitely did for me. So anyway, that's just a side note.
Awesome. Yeah, thanks for sharing that. I'm glad to hear that's helping. That's fantastic. That'll kind of lead us right into the next segment in just a second too. One other thing just to mention on the sleep, your hormones are definitely tied to your sleep. Absolutely. The night sweats are usually hormonal. If you can't fall asleep, if you're having trouble with waking up very frequently or sleeping too long, that's often a sign of hormonal imbalances. Okay. So moving right into emotions, let's talk emotions. Okay. They affect everything. Every aspect of your body even is affected by your emotions. A lot of times we don't want to think about them affecting us physiologically, but they do. Okay. There's so many different studies out there. There's so many books written about it. It's pretty amazing. I remember how my mind was expanded when I learned about all these different connections between emotions and our body and our overall health. Is pretty amazing. Okay. So let's talk a little bit, because we've already mentioned oils, essential oils that Autumn said she had some good experience with Freedom essential oil blend. So why would that work? How would that be impacting it? Well, scent is tied directly to the limbic region of your brain. And that's known by most of the people as the seat of your emotions. Okay. So whenever you're breathing in any kind of scent, okay, you're going to have your emotions are going to have to respond to that first. You're not actually going to have more of a physical response to it, as first you're going to have an emotional response to it. Okay. So this is why aromatherapy is also being used by many clinics, many therapists, doctors. They're starting to use aromatherapy just because they're recognizing this. They see that it's impacting others. So emotions, I mentioned that they're stored in the limbic region. And a lot of times that's what, I know when I first started looking to health, that's what I assumed. That's the only place that emotions were stored, was the brain, right? No, actually they're stored all over the body. Yes. There's a book called Releasing Emotional Patterns. And I thought I grabbed it, but I didn't. But I also have another book too. But in this Releasing Emotional Patterns, okay, it's written by Dr. Caroline Mine. If you want to go check it out, I have worn out my first copy of this book. It's that useful and how much it can help with your emotions. You can look up, say, you're experiencing anger, and you can look that up. You can look up anger and you can see, well, what body system or organ is that impacting it? It will tell you. And I've looked up enough. It's the liver. The liver is impacted by anger. Okay. And a lot of times anger is stored in the liver. So a lot of times if you've got a lot of stored emotions that you've just buried them down and you haven't dealt with them, you've been angry about something for so long, guess what? Your liver is going to be impacted by that. The health of your liver will be impacted by that. So that's why sometimes people will start different kinds of protocol, whether it be natural or conventional protocols, and they may not get the results that they're looking for because they haven't dealt with the emotional side of health yet. Okay. That's something that is so important, guys. And it's honestly just one of those things that I'm super passionate about. And I want you guys to know that's there. And and here's the other side of that book too. So I said, you look up the emotion. You could also look up a particular place. You've got something going on. Maybe you've got a skin rash going on. Does skin rash have an emotional counterpart? You betcha. You can look that up in that book and figure out what it is. And the cool thing about that book is it will also tell you what essential oil could help your body in releasing that emotion, okay, and bringing homeostasis and balance back to even possibly that organ system, okay? Isn't that amazing? It's so cool. This is a pretty much brand new book. called The Pathway to Emotional Healing. It's written by Jen McGraw. And she's a friend of a friend. I'm not sure if I've actually met Jen before, but I know I've met a bunch of her other friends. And I'm so impressed with this book. She's doing something very similar to the Releasing Emotional Patterns. But what she's also done for those of us that are believers, that are Christians, she's included scripture. She's included a scripture affirmation to help go along with the different emotions you're dealing with. Where could I go in scripture to help me find some truth? Okay. And I love that. It's also got the essential oils listed, the body system where it's impacting. Okay. It's all in there. So that's just another one. There's lots of different ones out there. Heal Your Body by Louise Hay. That's another great one. Feelings Buried Alive is another very good book. So there's several ones you could go check out, do some digging, especially if you feel like this is an area that I've got some chronic things going on. I've got some big time emotions. I've got some big life experiences I'm not sure how to deal with. They're impacting my sleep. I think they could be impacting my hormones. They could be impacting my digestion. I don't know, but I know I can't ignore it. And we're here to tell you, please don't ignore it. Okay. Go ahead, Autumn. I know you wanted to say something about that, about ignoring them.
Right. Here's the deal. Your emotions are going to come out in some way, and you as an individual get to choose how that is. It may take some work for them to come out in a healthy way, but I think we can all agree that your emotions coming out in a healthy way is more beneficial for everyone, including the people around you, than lashing out in anger, withdrawing, anxiety, all kinds of things. People react differently to different things, but the bottom line is your emotions are going to come out physically through some sort of emotional instability or lashing out, or you can choose to do it in a healthy way. Now, it's uncomfortable. It is. It's a lot easier to push it down and let it come out in those other more difficult ways in the end. But if you can figure out a way to get a hold on it, and this is a person who has gone through years of therapy, years of aromatherapy, several different methods. If anyone knows what it's like to be an emotional wreck, it's me. And so I'm speaking from experience here. It's going to come out in some way. We all have to choose how that's going to happen, and it affects the people around us. It really, really affects us. It's our choice. So
Absolutely. Absolutely. And you're not the only one. I've been there too. I'm on the other side of a lot of big stuff, but I still have. I mean, it's part of being alive. You still got things that you cope with, and so that's okay. But that's why we're doing these classes, is to give you some options and to help you know what's out there, know about some things that may be, so common and so easy to find that you just haven't started utilizing it yet. We're wanting to bring that to your attention. Okay. Something with the emotions. Autumn already mentioned therapy. Yes, absolutely. If you need to get a therapist, you need somebody to be talking to, absolutely get a therapist. There's also other ways you can do that. She mentioned aromatherapy. There's a technique called aroma freedom technique, AFT. I love it. When I first learned how to do it, it made a huge impact for me, for my loved ones. I was able to share that with a lot of people. It's very easy. You can get be certified in it, but you don't have to. You can actually buy the book, Aroma Freedom Technique. Okay, that's the name of it. It's even available on Amazon. But in that book, Dr. Benjamin Perkis, he's a clinical psychologist. Okay, so for any of you that are skeptic about it, yeah, this guy's got probably 25 years of experience in clinical psychology. And he kind of scoffed at aromatherapy at first. His wife got into essential oils and was like, "Oh, that's nice. That smells good, honey. Good for you." But then he started realizing there's something that was well known before that called the Proust phenomenon. And that's the effect of how that, it's the technical term what I was telling you about, how when you breathe in a scent, it affects the limbic region of the brain. Okay. And so he knew about that. And he had some really tough situations with clients and he couldn't really help them. He was not having much breakthrough. And so he says, what if I start using those oils that she's got? What if I try to do that? And that's how he created this technique. And he made it to be simple. He made it to be step by step, something that if you have no experience in emotional releasing or anything like that, you could do it. Okay. There's also a different level of it for traumatic events. Okay. You can make this technique is it can be super simple, or you can take it to a whole nother level. Okay. And that book tells you how to do it. It's pretty awesome. It uses very commonly found oils. The Dr. Perkis actually says in the book, he only recommends Young Living essential oils, and that's all you're going to hear me recommend as well, because of the safety of them and for several factors. But it's lemon. Well, that you can use that one. It's lavender, frankincense, and stress away. And he put those three together and he made what he called the memory release blend, MRB. And those three together really help you just to let go of a lot of different things. So that's your three main ones. You can use several different oils also in this particular, but guys, just breathing in an essential oil can help you to relax, can help you to release. It can help bring on cortisol levels. We're going to talk about that in just a minute too. It can make a huge impact, okay, just by breathing in nice, good, long, deep breaths, okay? Emotion Code, that's another one right there. That's a book you can also get and learn how to do that particular release. I've done that before. It's amazing. It's absolutely amazing how well it can work. It's taking it to a different level, okay? So consider that. EFT, emotional freedom technique. That's a tapping technique. We actually tap acupressure points. Let's see, it's here, here. I might not be going in the right order, but you're tapping acupressure points, and this helps relax and calm down your whole body immediately. It's amazing to see how well you don't have to actually be communicating with that person. You could, so let's say it's a small child that's not nonverbal at that time. Guess what? You can tap. Guess what? You can let them breathe in an essential oil too. You can diffuse the situation. See my diffuser? Yeah. Diffuse the situation, bring those emotions down. Okay. So it's huge. There's so many different aspects within emotions that you can do to set the tone for your day. One of my favorites that I usually do every single day, think of it as a proactive way of setting the tone for the whole day to go well, is something that Gary Young came up with called Gary's Happy Day Protocol. Yeah, I've seen it listed. Great Day Protocol, Happy Day. Look it up. You can find it online. But it's just 4 different oils that you're using. You use Valor Essential Oil on your wrist. You use Joy Blend over your heart. You use Harmony in your navel. And then you use White Angelica and you put a drop in your hands and you brush it over your whole body. And you could be right on top of your clothes. Guys, when I do that, I'm ready. I'm suited up for the day. Emotionally, I'm prepared for whatever comes my way. And I can see a difference in the days that my children use it and the days that they don't use it, okay? We're a homeschooling family, okay? So we're with each other all the time. And it helps bring stress levels down pretty significantly when we use that. Let's see, just a couple of quick other things, ideas for you to consider. If you're just like, hey, Keely, I don't want to have to read anything. I don't want to have to learn a technique or anything like that. I'm not sure about this. Guess what? Like I said, you could just use oils. If you're applying certain oils on the body, if you're breathing them in, your body is going to naturally let it go. Okay. And one of those, there's a kit from Young Living called the Feelings Kit. And it has several of the ones I mentioned from the Great Day Protocol actually already in there. 4 of them are actually in there. And so that's a great one. It actually even tells you, just apply them. And it'll give you some ideas of where to apply them on the body. Remember, it's acupressure points, okay? So that's a great one you can just work through. Just keep using those oils. Another one is the Freedom Sleep and Freedom Release Kit. I remember when this kit first came out, it was particularly designed for folks that had gone through extreme traumatic events. Okay. I remember what Autumn was mentioning about, she had those thoughts that would come and wake her up in the middle of the night. Okay. There's a lot of people that have extreme versions of that. Okay. Think of this kit for those people. That can make a huge difference. You order both of the kits come together, but you start with the freedom sleep is the beginning, and then you move into the freedom release. First, you get your sleep nice and steady. You get that steady, and then you move into the release. And that freedom oil blend she talked about that she had good results with, that's the main oil in both of the kits. Okay. And you can buy that one even by itself. So it's pretty amazing what it can do. Other oils that are just like top favorites just to think about: Release Oil Blend, Valor, Peace and Calming, Stress Away, White Angelica, Joy and Harmony. To me, those are like a really great starting place and what you can do with them. Let's talk minerals. Before we move on to hormones, let's talk minerals, okay? This is huge. This is huge for your emotional health. Yes, it impacts your sleep, and it does impact your hormones. Yeah, I told you this all was going to fit together. Okay, so minerals. Why minerals? Because minerals are a part of every cell and body fluid. They are the neurotransmitters that signal every action in the body. It's literally the body's electrical system. That's how minerals work. If you have a deficiency in certain minerals, it can result in emotional stress, big time. I found this list online. I thought this was fascinating. It actually tells you what emotions come out depending on what mineral deficiency you have. Okay, so magnesium. Guys, magnesium is the first mineral to be depleted when you're stressed. First one. Your body takes it. Your body is constantly trying to stay in a nice pH level of alkalinity. It tries to stay there. When you are stressed, your body moves into acid state, okay? And so your body uses those minerals to bring you back down into a nice alkaline state. So it's going to take it from wherever it can. So if you're not already supplementing in minerals, it's going to rob it from different parts of your body. I'm just telling you. This is why a lot of times when people are stressed, they're going to feel it in their muscles. Their muscles are going to tighten up and they're not going to relax anymore because they're just so tight. Because guess what? I mean, there's several factors going on there, but one of the factors is minerals. Okay. So if I need to relax those and relax my state, minerals. Okay. Also, I'm trying to think of something else. It doesn't really matter. Let me just keep going on with the minerals. Okay. So what happens if you're deficient in magnesium? How do you feel? Depressed, confused, agitated, anxiety. So you're anxious. You might experience even hallucinations. Wow. All different kinds of physical problems can happen with magnesium deficiency. Let's talk about calcium. If you are deficient in that, it's going to affect your whole central nervous system. Okay, remember, it acts like a neurotransmitter. It helps your body speak to each other. Low levels of calcium cause nervousness, apprehension, irritability, numbness. Okay, wow, lots of these things come up, when we're emotional. Zinc, apathy, lack of appetite, lethargic. You don't want to do anything anymore. That's a zinc deficiency sometimes. Iron can be depression a little bit, listlessness, exhaustion. Okay. Manganese. This one actually helps your body to use B vitamins or C vitamins. Since it plays a big role in amino acid formation, deficiency in it may cause depression from low levels of the neurotransmitters of serotonin and norepinephrine. Manganese also helps stabilize blood sugar, and it helps prevent hypoglycemic mood swings. I'm hangry. Maybe you need some manganese too. You need to eat some food, but you might need some manganese, okay? Thought that was so interesting. Let's see, potassium. Last one I'm going to mention here, frequently associated with depression, tearfulness, weakness, and fatigue. All of those, if you have a deficiency in potassium, that can happen, okay? I thought this quote was amazing. It's from the book Healthy Healing by Linda Page. She's a naturopath doctor and she has her PhD. She states minerals and trace minerals are the building blocks of life. the bonding agent between you and food. They keep your body pH balanced. They are essential to bone formation. They regulate the movement of cellular fluids, nerve electrical activity, and metabolic function. Trace minerals are only 0.01% of your body's weight, but even deficiencies in this micronutrients can cause severe depression, PMS, hyperactivity in children, blood sugar disorders, nervous stress, high blood pressure, premature aging, memory loss, and poor healing. That's a long list, isn't it? That's just from mineral deficiency. Many minerals are no longer even sufficiently present in our fruits and vegetables, leached from the soil by chemicals and pesticide spray used in commercial farming. So we kind of talked about that in making better choices, and I believe it was week 3, talking about better food choices to try to find better sources. But again, most of our soil is pretty nutrient deprived, which means, guys, you got to supplement. You've got to add in a few more supplements, because even as healthy as you eat, you're probably not able to get everything out of that food like you need to. Okay, so don't underestimate the power of a great Epsom salt bath. Epsom salt is a form of magnesium. Okay, remember, that's the first one that gets leached when you're emotional. That's the first one your body takes from. Well, let's put some back in. I'm going to tell you, it is like, it's an emotional reset for me if I go take an Epsom salt bath. I do, especially I've gotten to the point where I crave to have one like once a week, but especially if things have been really busy, hectic, a really high stressful day. Oh yes, please bring on the magnesium bath. Yes, and they're great for your kiddos too, to throw them in the bathtub with some Epsom salt. And you can even add in some essential oils to it. Just stir some essential oils into the dry Epsom salt. And here's the thing, guys, don't get the fragranced Epsom salt. They're fragranced with synthetic stuff, okay? It's not the natural stuff. And again, we're all about back to nature. Please don't get the lavender scented Epsom salt that's in the store. Don't do that. Just get you some lavender essential oil, a therapeutic level like Young Living, and add it into your dry salts, stir it in, and then throw it in the water. That way it'll disperse properly. So you're taking it to a whole nother level when you do that. I have taken that release oil blend before and added it in to my bath. You talk about letting things go. In a very positive way, guys. It's not usually a troublesome, like, wait, Keely, am I gonna be crying in the bathtub with this? No, not usually. It can happen, but most of the time it's just everything relaxes. My mind relaxes. My emotions get back where they need to be. It's awesome. When you're doing an Epsom salt bath for your emotional health, keep in mind that a hot bath is detoxifying, but a warm bath is rejuvenating. So warm bath lets your body actually absorb the minerals better. You can even take different mineral supplements and you can actually add them to the bathtub. So if you've got like a liquid mineral supplement, you can actually add that in and just get all the trace minerals at the same time. Why not? Okay, it's gonna help you in lots of ways. Does anybody else want to add anything there before I move on to hormones? Okay.
I could add real quick that, of course, no, you already talked about this. Never mind. Disregard.
That's okay. That's all right. No problem.
Wait a second. She just said that. Okay. Food is medicine.
No problem.
That's what I'm going to say. Food is medicine.
Okay. Yes, absolutely it is, for sure. All right. So moving on to hormones. Okay. Hormones are your chemical messengers of the body. That's how they work. They send very specific instructions to every organ. They help determine your mood, your energy level, your weight, your temperature, digestion, all different kinds of things about your health. And a lot of times we don't really appreciate those hormones until they're really not working well for us. That's pretty typical. The major endocrine glands that make up your hormones are your brain, okay? the hypothalamus and your pineal and pituitary glands specifically, your thyroid, your parathyroid, your adrenals, pancreas, reproductive glands, so ovaries and testes, but also your gastrointestinal tract. So yes, gut health does impact hormonal health. Keep that in mind. So whatever state your gut is in, that could be also reflecting what's going on with your hormone health as well. Okay. They also impact your sleep. Absolutely. Here's that connection again. With hormones, it's all about balance. It's kind of like a lot of people call it the Goldilocks effect. You want everything just right. Okay, you don't want too much of this or too little of this one. You want it right in a good balanced place. Okay, so mainstream medicine typically runs basic labs for hormone health. If your labs don't come back normal, you're typically given a synthetic hormone cream or pill that could have side effects. If those labs come back normal and you're still experiencing symptoms, you may be told you're either depressed or just getting older or you need to lose weight. This is what happens, okay? But this is where you get into kind of how most of us believe here in this group is that we're looking at functional medicine. We're looking at things, we're wanting to get to the root, okay? We go to the root cause, what's going on. I'd rather go to the root and do what I can to help the body to restore itself and then let it create and make those hormones just like God designed it to do. Okay, that's what I would much rather do. So we're going to go over some of the common hormone issues that are out there. Yes.
So we may have discussed this before, but there's a graphic that shows a fish in a dirty fish bowl and then a fish in a clean fish bowl. And when you see that fish in the dirty fish bowl, what is your first step? Is it if the fish is sick, do you give them a good environment first, or do you just throw some medicine in there? Do you treat the fish or do you treat the environment? You treat the environment first. It's the same thing here. The fish will be okay if you fix the environment. Same thing with the humans. If we have the right conditions for our bodies will do better. We just need to give them the right conditions, get back to nature.
Absolutely. And I'm really glad you brought that up because I don't think we've actually mentioned that in the series yet. That what Autumn just said, that's actually called terrain theory. Okay. There's germ theory versus terrain theory. Look those up. Go do some research there. But yes, terrain theory is very logical. It makes sense. If you're interested in getting back to nature, it's going to make a lot of sense to you. Okay. Thank you. I'm glad you brought that up. That kind of goes right into the environmental factors with hormones. Okay. And again, back in our early weeks, we talked about detoxing your environment. All those different chemicals that we have, a lot of them are endocrine disruptors. They're the ones that a lot of times they're wreaking havoc on your health, specifically your hormones. Okay. So something that in the Road to Wellness book, our inspiration for this series, that Deborah Rayburn talks about is she mentions doing a great liver flush. Okay. And you can also think of it as a cleanse. But a liver flush is often a really great way to kind of reset your hormones in a lot of ways. Whenever your liver stores a lot of extra hormones, okay, it's a filtration organ. It's your biggest filtration organ, and it stores a lot of stuff. And so if you can flush it out, change the filter, so to speak, in your liver, it's pretty amazing how well your body gets balanced after that. And she suggests that in her book. She talks about doing a 5-day liver flush and also a 5-day kidney flush. And she said that when she was still practicing as a naturopath, this is what she would usually recommend to a lot of her different clients. And after 5 days, it's amazing how great they felt. Okay. So just keep that in mind. And that's another reason why I highly encourage you to get that book, because you're here at Back to Nature. You're interested in getting on the road to wellness. You need this book. It's amazing and how it walks you through all those different things. She also suggests muscle testing for your supplements. It's also a good idea to figure out, well, how many do I need? If I'm going to be taking supplements, how many of these do I need per day? Or do I even need this supplement? Maybe this is not the right one for me. But absolutely, you can always do different tests. Okay, there's different like saliva tests, blood tests, urinary tests. There's different ways to check your hormone levels. Okay. And she does suggest that. She actually mentioned at one point, I believe it was, I'm going to look at it real quick, the lab that she uses, and there's lots of labs, but the one she uses is healthcheckusa.com for testing. And some people ask her, well, how often should I get my hormones checked? She's like, maybe every 6 months. It's up to you. But if you're going to start some kind of protocol, it's a good idea to check it after 6 months to see, hey, is it working? Are things balancing out like they should be? So moving on to the different types of hormones, and I'm specifically going to point out hormones that I'm going to mention how if they do have an impact on your emotions and if they have an impact on your sleep. Okay, I'm going to mention the ones that do that as well. So let me screen share because I'm actually going to share this. This is not original to me. I want to give credit where credit is due. Okay, so this is the particular article I wanted to share with you guys. This is from the Mind Body Green website. It's got a lot of good articles in there, but this one in particular was written by Dr. Will Cole. He is a naturopath doctor. He's also a chiropractor. He's got all kinds of initials after his name. This guy's very experienced. This article was named 7 Hormone Imbalances That Could Explain Your Fatigue, Moodiness, and Weight Gain. Okay. And so basically, Dr. Cole was wanting to share what were the most common things that were coming into his clinic. What hormonal imbalances were the ones first? Okay. This is where your adrenals, okay, are the ones that usually make the most cortisol. Okay. And that's your body's main stress hormones. Anytime that cortisol is too high, okay, it starts to actually rob from your other hormones. They call it the cortisol steal or the cortisol block. Okay, so this is one, if you've been under a lot of chronic stress or in a very stressful situation, maybe recently, it's a really good idea to look into how do I get my cortisol levels back in check, okay? This might be why you feel like you're just cycling all the time, that you feel like I can't get out of the stress. I may be relaxing, I may be doing all the right things, but I am still just totally stressed out all the time. I'm yelling at my kids. I'm doing this and doing that. Okay, that's probably a cortisol block. Know that. And this is where it can really help you to get back into shape. So what could be the experience you're having if your cortisol's high? You're slow to start in the mornings. You crave salty or sugary foods, low sex drive. You're fatigued in the afternoon, but you get a second in the evening. I used to be a person. You can't stay asleep, okay? Cortisol is actually highest at 2 a.m., okay? So I hear a lot of people sometimes say, I wake up all the time at this time of the night. Well, maybe this is a factor going on here. Maybe your cortisol's peaked and you can't stay asleep. You're dizzy when you stand up too quickly. You have headaches in the afternoon, blood sugar issues, chronic inflammation, your nails are weak. Often you're very moody and you have difficulty losing weight. That's a sign of cortisol imbalance, okay? What does Dr. Cole usually do with his patients? He does a adrenal stress index. It's just a very easy fit test, salivary test to track it. This is a very inexpensive test to get to. Most chiropractors, even I know several actually keep them in office that you can do, but you could also get them online. Super easy to do. The second one that he sees a lot of is thyroid imbalances. Okay, so every cell of your body needs thyroid hormones to function healthy. Okay, a lot of times there's underlying thyroid problems that don't even show up in standard labs. A lot of times you may go to your regular MD and he orders a thyroid panel and he tells you, you're in the right range, you're good. Here's the thing, there's like multiple thyroid panels that you can order and you need to order all of them. to get the full picture for your thyroid. That's just the way it is. You want to know, do I have the hormone? Is it free floating in my blood, or is it actually being utilized in my blood? That's what those different tests are asking. Okay. And he's even mentioned, sometimes thyroid conversion issues, that's where it even could turn into like autoimmune or Graves. Okay. Really important thing to, especially if you're not feeling well, something's really off. It's time to get checked. Okay. It's time to check it out. What do you feel when your thyroid's out of balance? Tired, chronic cold hands and feet, or maybe you're chronically cold all over. You are enough sleep to function properly. You have weight gain. Even if you're eating well, you might be eating really low calorie and you still have weight gain. Difficult and frequent bowel movements, depression, lack of motivation, morning headaches that wear off as the day progresses. The outer third of the eyebrow is thin. This is something you can see on some people from like about right here out. It's like they don't even have eyebrows anymore, or it's thin. That's a quick sign of a thyroid imbalance. Thinning of hair on the scalp. Excessive hair falling out, okay? Dry skin, mental sluggishness, okay? So here's the different labs that he talks about. The mainstream medicine typically just run the TSH and the T4, but you want more. You want all of them, okay? And I love this in Deborah's book, in Road to Wellness. Deborah actually has here the normal ranges, not the common ranges. Okay, a lot of times different practitioners will compare to what's common. They'll say, hey, you're in range. Well, is that common, or is that really a healthy normal range? Deborah's got the healthy normal ranges in this book, so you can actually compare. Get your stats, get your labs, and check it out. Compare and contrast, know if you're in the right area. Okay. Estrogen. Okay, the ratio of estrogen. Okay, there's several different types of estrogen. I'm not going to go into all that, but it is important for both men and women. What right now in our world, there's usually an excess of estrogen. A lot of people have too much of it. Let's see what happens if you have not enough. Okay, here's the not enough right here. For ladies, vaginal dryness, night sweats, painful sex, brain fog, reoccurring bladder infections, feel lethargic, depression, or hot flashes. That might be not enough estrogen. If you have too much, you may feel puffy and bloated. You may have a lot of weight gain just really quickly, breast tenderness, mood swings. You might have a really heavy menstrual cycle, feeling anxious or depressed. There's those emotions coming in. Migraine headaches. You may have a cervical dysplasia, like an abnormal pap smear. Insomnia, there's the sleep. That's too much estrogen right there in this case. Brain fog, gallbladder problems, weepy and emotional. Okay, and remember, right now in the world, we see usually an excess of estrogen. That's very common. Okay. Yes, know that. So how do you get that checked? Full blood panel, a full panel, and salivary female hormone panel. Okay, so there's a lot of different things to check for that one. This is where you're going to need to go get labs to figure out where am I in that particular area. Progesterone. Okay, both men and women actually need progesterone to help their body balance. But progesterone is awesome because it helps keep your estrogen levels where they need to be and your testosterone levels where they need to be. They help balance it out. That's how that hormone kind of works. So what would you experience if you've got an imbalance going on with progesterone? PMS. PMS is common, right? It's not normal, guys. It's not. Insomnia, unhealthy looking skin, painful breast, stubborn weight gain, cyclical headaches, anxiety. And so how do you determine that if you have a progesterone imbalance? Full blood or salivary female hormone panel. Okay, so it's again a biggie to figure that out. I can say right now, testimony wise, that I've used Progestance Plus serum. It's a progesterone serum from Young Living. I've used it for years now, and guys, it was a huge game changer. I started using that, and like my cycles are completely normal. The anxiety that I felt, a lot of times I can use that to even reduce anxiety at times. I sleep great. I'm just amazed at how balancing that particular serum has been for me. So I love that one. Testosterone. This is another one that Dr. Cole noticed. Both men and women, low testosterone is something that's commonly seen in practice, okay? Low testosterone in women has been linked to studies in low sex drive, heart disease, and breast cancer. Wow. One study found men with low testosterone had a greater rate of death. Okay. So you want it. You want some testosterone, lady. Want it, men? Yes. What if women have too much testosterone? What would they experience? Acne, PCOS, excessive hair on the face and arms, hypoglycemia or unstable blood sugar, thinning hair, fertility struggles, ovarian cyst, and mid-cycle pain and cramping. If women don't have enough, they have weight gain, fatigue, or low sex drive. So what would men possibly experience? Okay. Erectile dysfunction, low sex drive, weight gain, irritability, and breast enlargement. Again, this is going to be a blood and salivary and a panel. Okay, so it's a lot for that one again. Leptin was another one he saw. I didn't actually, I've heard of leptin, didn't really do a lot of research, but okay, this is something, leptin is what fat cells actually produce it. Okay, your fat cells produce a hormone called leptin. One of its jobs is to tell your brain to use the body's fat stores for energy. Leptin resistance occurs when leptin is not recognized by the body, specifically the hypothalamic, I think I'm saying it right, cells of your brain. Your body then thinks it's in starvation mode, which makes it want to store more fat. Yikes. So it's like reverses what you're wanting. What would you experience? Overweight, don't lose weight easily, constant food cravings, and stressed out. There's the emotions again. And this is just a serum leptin test. So it'd be a blood test. Insulin. Guys, insulin is a hormone. Okay. Sometimes we forget that. We just hear insulin and we automatically go to blood issues, right? We just think of that. Well, insulin is what helps your body balance your blood sugar. If you have severe issues with blood sugar, you are referred to an endocrinologist, a hormone specialist. Okay, so know that. Just like leptin resistance, insulin resistant is not a hormonal deficiency, but it's a hormonal resistance pattern. Okay, so but again, there's something going on. Most people know insulin resistant when it comes to type 2 diabetes, but insulin resistance also seen in many people who have not progressed to full-blown diabetic disease. Okay. What are some of the things that you might experience with insulin imbalances? You crave sweets. There's an obvious one. Irritableness if meals are missed. Okay, that's your hangry right there. Dependence on coffee. Become lightheaded if meals are missed. You feel shaky, jittery. You have tremors. Here's the emotions. You're agitated, easily upset. You're nervous. Poor memory, blurred vision, fatigue after meals, eating sweets doesn't relieve the sugar cravings. Your waist girth is equal or larger than your hip girth. Frequent urination, increased thirst, and difficulty losing weight. Again, that's going to be a lot of different blood tests, and that one's very specific. And consult with a healthcare practitioner on that one. Okay. Again, so just know I wanted to get a taste of the hormones, and you could see there were several different things in there relating to the emotions, relating to sleep. Okay, I can tell over the years that I've worked to naturally balance my thyroid that my sleep has improved. Naturally balancing my progesterone improved my sleep. And just even having some, again, those healthy habits, healthy habits of self-care, taking care of myself when I am stressed, making sure I go to bed at a decent hour. That's it. It's like, don't sabotage your sleep. You could be the factor standing against you in good sleep. Okay. So keep that in mind. All right. that is what I've got for you tonight. That's what we've got for you tonight. I'm going to go ahead and stop the recording, and then we can chat a little bit more right here in the group. But thank you for those watching the recording. Thank you for those that joined us tonight. I'm really glad you came. We hope that this has been a blessing to you.